California, known for its stunning landscapes and vibrant cities, is also home to one of the largest homeless populations in the United States. Homelessness in California has reached unprecedented levels, with over 187,000 people experiencing homelessness as of January 2024. This accounts for nearly a quarter of the nation's homeless population. The crisis has been escalating over the past decade, with homelessness rising by 31% since 2010. The state's homeless population includes individuals from diverse backgrounds, including families, veterans, and young adults. California's homelessness crisis is not limited to major urban centers like Los Angeles and San Francisco. It extends to smaller cities and rural areas, affecting communities across the state. The causes of homelessness are multifaceted, involving economic, social, and systemic factors. High housing costs, unemployment, mental health issues, and substance abuse are significant contributors to the crisis. Additionally, systemic barriers, such as lack of affordable housing and inadequate support services, exacerbate the problem. The impact of homelessness is far-reaching, affecting both homeless individuals and the broader community. Homeless individuals face daily struggles for survival, including finding food, shelter, and medical care. The lack of stable housing makes it difficult for them to secure employment and access necessary services. For families experiencing homelessness, the challenges are even greater, as children suffer from disrupted education and developmental issues. Communities also feel the impact of homelessness, as public resources are strained to provide support and services. Homeless encampments can lead to public health concerns, and the visibility of homelessness affects the overall quality of life for residents. Business owners and residents often grapple with finding solutions to address homelessness while balancing the needs of the community. Efforts to address homelessness in California have been ongoing, involving government initiatives, nonprofit organizations, and community groups. However, despite these efforts, the crisis continues to grow. This video aims to explore the causes of homelessness, the impact on individuals and communities, and potential solutions to address this pressing issue. Understanding the scope of the crisis is crucial to finding effective solutions. By examining the root causes and exploring innovative approaches, we can work towards a future where everyone has a safe and stable place to call home. High cost of living. The high cost of living, particularly housing, is a major driver of homelessness in California. The state has some of the highest housing costs in the nation, making it difficult for many to afford a place to live. In cities like San Francisco and Los Angeles, even small apartments can cost thousands of dollars a month. The high cost of housing in California is a significant barrier to affordable living for many residents. According to the California Housing Partnership, over 1.3 million low-income households lack access to affordable rental housing. The median rent in cities like San Francisco and Los Angeles often exceeds $3,000 per month, making it nearly impossible for low and moderate-income families to secure housing. Several factors contribute to the high cost of housing. The demand for housing in desirable areas far outpaces the supply, leading to competitive markets and skyrocketing prices. Additionally, land use regulations and zoning laws often restrict the development of new housing, particularly affordable housing. This limited supply, coupled with high demand, drives up housing costs. The impact of high housing costs is felt most acutely by low-income individuals and families. Many are forced to spend a significant portion of their income on rent, leaving little for other necessities like food, health care, and transportation. This financial strain can lead to housing instability, as individuals and families are unable to keep up with rent payments and face eviction. The lack of affordable housing also affects those who are already homeless. Transitional housing and shelter options are limited, and wait lists for affordable housing can be years long. This makes it difficult for homeless individuals to find stable housing and begin the process of rebuilding their lives. Addressing the high cost of housing requires comprehensive policy changes and investment in affordable housing development. Increasing the supply of affordable housing through incentives for developers, reducing regulatory barriers, and implementing rent control measures can help alleviate the housing crisis. Additionally, expanding housing assistance programs and providing support for low-income renters can prevent housing instability and reduce the risk of homelessness. By addressing the root causes of high housing costs and increasing access to affordable housing, we can create a more equitable and stable housing market for all Californians. Unemployment and underemployment. Unemployment and underemployment are significant factors contributing to homelessness. While California boasts a strong economy, not everyone benefits equally. Many individuals struggle to find stable, well-paying jobs, leaving them unable to afford housing. California's economy is one of the largest in the world, driven by industries such as technology, entertainment, and agriculture. Despite this economic strength, many residents face challenges in securing stable employment. The unemployment rate in California has fluctuated over the years, and while it has improved since the Great Recession, underemployment remains a persistent issue. Underemployment occurs when individuals work part-time jobs or jobs below their skill level because they cannot find full-time or suitable employment. This often results in insufficient income to cover basic living expenses, including housing. The gig economy, characterized by short-term contracts and freelance work, has grown in recent years, offering flexibility but often lacking job security and benefits. Many gig workers face unpredictable income and limited access to health care, retirement plans, and other essential benefits. Certain populations face additional barriers to employment. Individuals with disabilities, minorities, and those with criminal records often encounter discrimination in hiring practices, limiting their job opportunities. Single parents and caregivers may also struggle to find employment that accommodates their responsibilities, leading to underemployment. The COVID-19 pandemic further exacerbated unemployment and underemployment, leading to widespread job losses and economic uncertainty. Many industries, such as hospitality, retail, and entertainment, were severely impacted, resulting in significant layoffs and reduced work hours. The loss of income during the pandemic pushed many individuals and families into financial hardship and homelessness. Addressing unemployment and underemployment requires a multifaceted approach. Creating job opportunities that offer fair wages and benefits is essential. This includes investing in industries expected to grow, such as renewable energy, technology, and healthcare. Providing job training and education programs can help individuals transition to these new fields and acquire the skills needed for stable employment. Policies that support small businesses and entrepreneurship can also create more jobs and reduce unemployment. Small businesses are a significant source of employment in many communities, and supporting their growth can lead to increased job opportunities. Expanding social safety nets, such as unemployment benefits and food assistance, can provide crucial support to individuals and families facing job loss or underemployment. These programs can help prevent poverty and provide a safety net for those in need. By addressing the root causes of unemployment and underemployment and providing support for those affected, we can create a more stable and equitable job market. Mental health issues. Mental health issues are a significant factor in the rise of homelessness. Many homeless individuals suffer from untreated mental health conditions, such as depression, anxiety, and schizophrenia. The lack of access to mental health services exacerbates these conditions, making it difficult to maintain stable housing and employment. Mental health issues are both a cause and a consequence of homelessness. According to the Substance Abuse and Mental Health Services Administration, SAMHSA, approximately 30% of homeless individuals have serious mental illnesses. The challenges of living without stable housing can worsen mental health conditions, leading to a cycle of instability and homelessness. The stigma surrounding mental health often prevents individuals from seeking help, exacerbating their conditions. Many homeless individuals with mental health issues face barriers to accessing care, including lack of insurance, limited availability of services, and transportation challenges. This results in a cycle of instability, where untreated mental health conditions lead to homelessness, which in turn worsens mental health. Community-based programs and outreach initiatives play a crucial role in providing mental health care to homeless individuals. Mobile clinics, street outreach teams, and drop-in centers offer accessible mental health services, helping to bridge the gap for those who might not seek help otherwise. These programs provide critical support, including counseling, crisis intervention, and connections to long-term mental health care. They also offer case management services to help individuals navigate the complex healthcare system and access the resources they need. However, these efforts often face significant challenges, including limited funding and resources. The demand for mental health services far exceeds the available capacity, leaving many individuals without the care they need. Additionally, the stigma associated with mental health issues can prevent individuals from seeking help, further exacerbating their conditions. Expanding access to mental health care requires significant investment in mental health services and infrastructure. This includes increasing funding for community-based programs, expanding the availability of mental health professionals, and integrating mental health care with other support services, such as housing and employment programs. Efforts to reduce the stigma associated with mental health issues can encourage more individuals to seek help. Public awareness campaigns, education, and advocacy can help shift societal attitudes and promote understanding and support for those facing mental health challenges. By addressing the mental health needs of homeless individuals and providing comprehensive support, we can help break the cycle of homelessness and improve the quality of life for those affected. Substance abuse. Substance abuse is another major contributor to homelessness. Addiction to drugs and alcohol can lead to job loss, strained relationships, and eviction. The rise in opioid and fentanyl addiction has made the situation even more challenging. Substance abuse is both a cause and consequence of homelessness. Many individuals turn to substances as a way to cope with the stress and trauma of living on the streets. However, substance abuse can lead to a downward spiral, exacerbating financial instability and making it difficult to maintain employment and housing. Without proper treatment and support, those struggling with addiction often find it impossible to break free from the cycle of homelessness. Substance abuse treatment programs are essential in providing the support needed for recovery. Treatment programs offer a range of services, including detoxification, counseling, and medication-assisted treatment. These programs aim to help individuals overcome their addiction and develop the skills needed to maintain sobriety. Support groups, such as Alcoholics Anonymous and Narcotics Anonymous, provide a community of peers who can offer encouragement and accountability. Community-based programs and outreach initiatives also play a crucial role in connecting individuals with substance abuse treatment and support services. Mobile clinics and outreach teams can provide harm reduction services, such as needle exchange programs and safe injection sites, to reduce the risk of infectious diseases and provide a pathway to recovery. Addressing substance abuse requires a holistic approach that includes expanding access to treatment programs, providing harm reduction services, and creating supportive housing options for those in recovery. Harm reduction services can help reduce the immediate risks associated with substance abuse and provide a gateway to treatment. Supportive housing programs that offer integrated services, including addiction treatment, mental health care, and job training, can provide the stability and resources needed for long-term recovery. By addressing the root causes of addiction and offering ongoing support, we can help individuals break free from the cycle of homelessness and substance abuse. Impact on communities. The impact of homelessness is felt throughout the state. Homeless individuals face daily struggles for survival, while communities grapple with the challenges of providing support and services. The crisis also strains public resources and affects the overall quality of life for residents. Homelessness affects not only those experiencing it, but also the broader community. Public spaces, such as parks and sidewalks, often become makeshift shelters for homeless individuals, leading to public health concerns and safety issues. The visibility of homelessness can create tension within communities, as residents and business owners seek solutions to address the issue. Communities are often divided on how to address homelessness. While some advocate for increased support and services, Others push for stricter enforcement and removal of homeless encampments. Finding a balanced approach that addresses the needs of both homeless individuals and the community is essential. Homelessness also strains public resources, including emergency services, healthcare, and law enforcement. Homeless individuals often rely on emergency rooms for medical care, leading to increased healthcare costs and overcrowded facilities. Law enforcement officers frequently respond to calls related to homelessness, diverting resources from other public safety needs. Despite the challenges, many communities are coming together to provide support and advocate for solutions. Community outreach programs, nonprofit organizations, and volunteers play a crucial role in offering services and support to homeless individuals. Community outreach programs provide essential services such as food, clothing, and healthcare to homeless individuals. These programs often operate mobile clinics and outreach teams that connect individuals with the resources they need. Nonprofit organizations and faith-based groups also provide shelter, job training, and case management services to help individuals transition out of homelessness. Efforts to address homelessness must be multifaceted, focusing on both prevention and intervention, providing affordable housing, expanding access to mental health and substance abuse treatment, and offering job training and employment opportunities can help prevent homelessness. At the same time, emergency shelters, supportive housing, and outreach programs provide immediate relief and support for those already experiencing homelessness. By addressing the root causes of homelessness and providing comprehensive support, we can create a more inclusive and compassionate community where everyone has the opportunity to thrive. Government initiatives. Efforts to address homelessness in California have been ongoing. Government initiatives, such as the Homeless Emergency Aid Program, HEAP, and Project Homekey, aim to provide immediate relief and long-term housing solutions. The Homeless Emergency Aid Program, HEAP, was established to provide local governments with flexible funding to address homelessness. This program allows cities and counties to tailor their response to the unique needs of their communities. HEAP funds can be used for a variety of purposes, including emergency shelters, rental assistance, and outreach services. HEAP has provided much-needed resources to communities across California, helping to expand emergency shelter capacity, provide rental assistance, and support outreach efforts. However, the demand for services continues to outpace the available resources, highlighting the need for sustained investment in homelessness programs. Project Homekey is another significant initiative aimed at addressing homelessness. This program, launched in response to the COVID-19 pandemic, provides funding for the purchase and conversion of hotels, motels, and other properties into permanent supportive housing. By repurposing existing buildings, Project Homekey aims to quickly provide safe and stable housing for homeless individuals and families. Project Homekey has been a game-changer in the fight against homelessness, providing thousands of individuals with permanent supportive housing in a relatively short period. The success of this program demonstrates the importance of innovative and flexible solutions in addressing the homelessness crisis. In addition to HEAP and Project Homekey, California has implemented several other initiatives to combat homelessness. These include the California Access to Housing and Services Fund, which provides rental subsidies and supportive services, and the No Place Like Home program, which funds the development of permanent supportive housing for individuals with mental health conditions. While these government initiatives have made significant strides in addressing homelessness, challenges remain. The demand for affordable housing and support services continues to exceed the available supply, and many individuals face barriers to accessing these resources. Addressing homelessness requires sustained investment and collaboration between federal, state, and local governments, as well as nonprofit organizations and community groups. By working together and continuing to innovate, we can make progress towards ending homelessness in California. Effective allocation of funding is crucial to the success of homelessness initiatives.